You ready?
Yeah, but I like to listen to what. Yeah, sure.
Must be 10 o'clock. We, because of votes yesterday afternoon, we rolled the opening statements into this morning, so we will begin, and I will yield myself 5 minutes, so I won't take that for sure. So this marks our 8th full committee markup this Congress, with over 70 hearings on the books. We had advanced nearly 24 bills through the House. This committee has built a proud record of bipartisan success, and we look to continue our momentum as we consider 6 bills to protect kids, improve public health, and boost jobs and manufacturing. These bills will indeed have a positive impact, certainly in Michigan, but across the country as well. First, consider H.R. 985, legislation that it would allow the concrete masonry industry to establish a national checkoff program to help support industry programs related to generic research, promotion, and education. This legislation, authored by Representatives Guthrie and Castor, has strong bipartisan support and offers manufacturers a uniform opportunity to help grow their businesses and in fact, create jobs. We'll next consider H.R. 3154, the E-Warranty Act, authored by Representative Mullen and Losbach. This bipartisan bill provides important regulatory flexibility to manufacturers by allowing them to post product warranties online. We live during a time when internet connectivity and networked sensors are being integrated into every facet of our life. The use of the internet and other advanced technologies is generating significant efficiencies and resources savings for businesses and consumers that should be available to every sector of the economy. This measure helps to extend that opportunity, modernizing guidelines for the 21st century. We'll consider 4 public health bills: H.R. 1344, the Early Hearing Detection and Intervention Act of 2015, introduced by Health Subcommittee Vice Chair Guthrie and Capps, and would reauthorize a program for early stem cell transplantation program. Home of the largest bone marrow transplant patient unit is in Michigan. Discussed a double cord transplant with Ms. Mays. About 30,000 cord blood transplants have been performed nationwide since they began in the mid-1990s, and about 10,000 have been double cord transplants. Shortly following the procedure, LMA Mays was soon in remission as she celebrated her 60th birthday last August. Reauthorizing this bill will ensure similar miracles like Ms. Mays are possible. So we have 6 important bills before us. I urge their approval and would note that all members' statements can be entered as part of the record by UC. And with that, I'll yield to the ranking member of the committee, Mr. Pallone, for an opening statement.
Thank you, Chairman Upton, for convening today's full committee markup on 6 bills that all successfully passed the relevant subcommittee with unanimous member support. As we look to a well-deserved district work period, let me commend you and your staff for their willingness to work with Democrats to ensure that all of the bills before us include our views. First is H.R. 985, which would establish a concrete masonry products board that would require the collection of fees from manufacturers of concrete masonry products to fund programs and activities that would promote the concrete masonry industry. The bill before us addresses many of the concerns we have heard about this bill and has my support. Now the bill ensures fairness within the concrete masonry industry and within the construction product industry overall, and includes provisions that increase the concrete masonry board's accountability. Second, we will also consider the E-Warranty Act of 2015, introduced by Representatives Mullen and Lobsack. This bipartisan bill will help modernize the rules regarding pre-sale warranty notice by allowing warranty information to be made available online. While I support this bill, I encourage the FTC to require that the non-electronic means of obtaining warranty information provided for in this bill is available to consumers for free and in a timely manner. I also expect that FTC's rulemaking will maintain the current protections for consumers and small business owners without internet access, including requiring that manufacturers ensure sellers can fulfill their pre-sale notice obligations. Third, we'll also consider a number of important public health bills, including the NASPR Reauthorization Act, which will help states establish and maintain prescription drug monitoring programs in order to combat prescription drug abuse. It's a public health crisis affecting so many communities across the country, and this is an important step in our efforts, and I look forward to working again with Representatives Whitfield, Kennedy, and Bichon to find ways to ensure it receives critical funding. Our fourth bill, H.R. 1462, the Protecting Our Infants Act of 2015, also addresses the opioid epidemic. Unfortunately, there's been a steep increase in the incidence of neonatal abstinence syndrome, or NAS, a negative health outcome that occurs in newborns who are exposed to painkillers while in their mother's womb. This important bill, introduced by Representative Catherine Clark, would require HHS to develop recommendations for the treatment and prevention of prenatal opiate abuse and NAS, and would also require collection of data to better monitor the problem and the development of a coordinated research strategy at HHS. Our fifth bill, H.R. 2820, the Stem Cell Therapeutic and Research Reauthorization Act, introduced by Representative Matsui, continues our highly successful Be the Match registry to ensure continued federal support to help patients in need of bone marrow transplants find their match. And this program is truly life-saving. And the final bill, the sixth one, H.R. 1344, the Early Hearing Detection and Intervention Act of 2015, would reauthorize the successful early hearing detection and intervention program. This program ensures that 97% of newborns receive screening for hearing loss. As a result, children gain early access to interventions and treatments that are critical in minimizing a hearing-impaired child's risk of developmental delays. Thank you to Representative Capps for her leadership on this important public health issue. So, Mr. Chairman, thank you again for working with us to move these bills forward, and I yield back the balance of my time.
Gentleman yields back. Other members wishing to make an opening statement? Chair would recognize the Chair of the Health Subcommittee, Mr. Pitts, for 5 minutes.
Thank you, Mr. Chairman. During this full committee markup, members will consider 4 bipartisan public health bills to improve health care for newborns, infants, and children, strengthen national marrow donor program and the cord blood donation, and a bill designed to curb prescription drug abuse. The Health Subcommittee approved each of these bills unanimously last Thursday, and my remarks today will be limited to these bills. As many of you know, one of the Health Subcommittee's top priorities has been helping and protecting children and families, and these bipartisan bills before the full committee today represent our ongoing effort to work together to strengthen public health, solve problems in our nation's healthcare system. H.R. 1344, the Early Hearing Detection and Intervention Act, authored by Health Subcommittee Vice Chairman Brett Guthrie and Representative Lois Capps, amends the Public Health Service Act to reauthorize a program for early detection, diagnosis, and treatment regarding deaf and hard of hearing newborns, infants, and young children. The Child Health Act of 2000 first authorized newborn screening, hearing screening, and at that time, only 40% of newborns were being screened. Today, over 95% of newborns receive hearing screenings. This is essential for the 33 children born every day with hearing impairment, a common congenital condition. Once detected, the child can receive the necessary language stimulation and benefit from early intervention. Secondly, H.R. 1462, the Protecting Our Infants Act of 2015, authored by Representative Catherine Clark and Steve Stivers, will combat the rise of prenatal opioid abuse and neonatal abstinence syndrome, NAS. Babies born with NAS often need to be hospitalized for weeks, can suffer from seizures, other complications. In recent years, sadly, there's been a steady rise in the number of overdose deaths involving heroin. The bill will address the growing problem, help protect newborns and infants, and Senate Majority Leader Mitch McConnell has sponsored the companion bill, S-799. Thirdly, H.R. 1725, the National All Schedules Prescription Electronic Reporting Reauthorization Act, or NASPR, is an important program that helps states combat prescription drug abuse of controlled substances through prescription drug monitoring programs, PDMPs. NASPR is administered by the Department of Health and Human Services and provides grants to states to establish and improve prescription drug monitoring programs. This legislation will ensure states have adequate funding to address the needs of prescription drug abuse and will help prevent patients from doctor shopping and abusing prescription drugs. It will ensure appropriate law enforcement, regulatory, and state professional licensing authorities have access to prescription history for purposes of investigating drug diversion and errant prescriber or pharmacist prescribing and dispensing practices. Finally, H.R. 2820, the Stem Cell Therapeutic Research Reauthorization Act, introduced by Representative Chris Smith, endorsed Matsui, reauthorizes the Stem Cell Therapeutic Research Act of 2005, which provides federal support for cord blood donation and research essential to increasing patient access to transplant. I support each of the bills, urge their adoption by the committee, and yield back the balance of my time.
Gentleman yields back. Other members wishing to speak? Chair would recognize the gentlelady from California, Ms. Eshoo.
Thank you, Mr. Chairman, and good morning to all the members. And thank you for convening this markup of legislation relating to infant death, prescription drugs, and important stem cell transplant programs. Every bill before us today has bipartisan support, and I think that that is very important to underscore and reflects the work that's been done not only by the leadership of the committee, but by its members as well. I'd like to briefly highlight two of the bills before us today because I'm especially pleased that the committee is taking them up. Excuse me. The national law schedules prescription electronic reporting Authorization Act, kind of a mouthful, reauthorizes the NASPR program, which assists states in combating prescription drug abuse. This is a very, very big issue across our country. Drug overdose death rates have risen steadily in our country since 1970, and data from the last decade shows that prescription drug abuse is epidemic in the United States. According to NASPR, since 2007, there's been an overall prescription drug abuse, and it has increased 149%, with increases ranging from 222% for morphine to 1,293% for methadone. These are just stunning figures. The legislation will encourage states to adopt prescription monitoring programs which collect statewide data about prescription drugs and track their flow. And although the success of these monitoring programs is evident, it remains obvious that there's much more work to be done, and I welcome the committee's commitment to combating this epidemic. The Stem Cell Therapeutic and Research Authorization Act reauthorizes two important programs for saving the lives of thousands of patients who have been diagnosed with life-threatening blood cancers like leukemia and lymphoma. For these patients, a bone marrow or cord blood transplant may be their only hope for a cure. Over the last 30 years, the National Cord Blood Inventory and the C.W. Bill Young cell transplantation programs have matched patients with over 11 million potential donors and 193,000 cord blood units donated by mothers. Through international coordination, the registries now include over 24.5 million international donors and 622,000 cord blood units worldwide. So we're building on an excellent foundation that's already out there. The other four bills on the docket today are also deserving the committee's support. The concrete masonry bill has over 260 co-sponsors, had over 260 co-sponsors in the last Congress, so it's earned its way to the dais today. Again, thank you to everyone that has been involved in shaping the bills, the leadership that's worked together to bring them forward, and I think that the committee can go off for its August break and be pleased about the work that it's done. With that, I yield back the balance of my time. I don't have any balance of time, but thank you.
Gentlelady's time expired. Other members wishing to speak? The chair would recognize the gentlelady from Illinois, Ms. Tchaikovsky, for 3 minutes.
Thank you, Mr. Chairman. All 6 bills have bipartisan support, and this is a great way to head into the August district work period, and I hope it is a sign of things to come. I'm very proud of this committee. I think it's probably the only one that has really put so many bills out on the floor. Last week, the Commerce, Manufacturing, and Trade Subcommittee held a markup on H.R. 985, the Concrete Masonry Products Research, Education, and Promotion Act. I've heard from many of my constituents, including concrete masonry manufacturers and workers, about the benefits this bill would bring. A manager's amendment was offered and accepted that will better ensure that this program is effective in terms of both management and oversight. I thank Representative Guthrie, Representative Castor, and others who have fought for this bill for their willingness to incorporate those changes. Another bill from the CMT subcommittee, the E-Warranty Act, would allow companies to post product warranties online. This is a common sense modernization of existing standards, but it will also importantly ensure that consumers can still get warranties in paper form in store when they purchase a product. I'm also proud to support the 4 bills that have been reported out of the Health Subcommittee. H.R. 1344, the Early Hearing Detection and Intervention Act, will reauthorize and expand the Early Hearing Detection and Intervention Program through 2022. In Illinois alone, over 19,000 children are served by our state's Early Intervention Program. We've seen an increasing number of neonatal abstinence syndrome cases over the last decade. In response, H.R. 1462, the Protecting Our Infants Act, will develop recommendations for treatment and prevention and improve coordination across the federal government to reduce this trend. In response to devastating increases in prescription opioid abuse, H.R. 1725, the NASPR Reauthorization Act, will support state prescription drug monitoring programs, an important tool in combating abuse and addiction, and I support H.R. 2820, the Stem Cell Therapeutic and Research Reauthorization Act, which helps individuals in need of bone marrow transplant find bone marrow and cord blood matches. So again, let me just end by saying we should all feel really good about the Energy and Commerce Committee. I want to thank you, Mr. Chairman, and all the and the ranking member and all the subcommittee chairs, et cetera. We're doing a good job, and I'm proud of that. Thank you. I yield back.
Appreciate the kind words. Other members wishing to give an opening statement? Chair would recognize the gentlelady from California, Ms. Matsui.
Thank you very much, Mr. Chairman. I want to thank you and the ranking member for all the bills that we're marking up today in this very bipartisan manner. And I associate my remarks with those of my colleague who just spoke. I support every single one of them. I want to really make sure that I want to emphasize H.R. 2820, which is the Stem Cell Therapeutic and Research Reauthorization Act that's for markup today. This legislation will reauthorize funding for the C.W. Bill Young Cell Transplantation Program, operated by the National Marrow Donor Program, otherwise known as Be the Match. It will also reauthorize a national cord blood inventory. These programs provide hope to the thousands of Americans who suffer from blood cancers or other blood disorders and are searching for a match to life-saving bone marrow or cord blood transplant. Every 4 minutes, someone is diagnosed with blood cancer or another blood disorder, and often the only cure for these fatal diseases is a bone marrow or cord blood transplant. And during the last 30 years, the National Registry has grown to 11 million adult volunteers, donors, and 193 cord blood units. The growth is promising, but we must continue our efforts to encourage the donors. The Bone Marrow Registry and Cord Blood Bank also support critical medical research that improves outcomes for the more than 70 conditions for which transplant is a cure and helps to find ways to battle additional conditions. The C.W. Bill Young Transplantation Program also includes the Office of Patient Advocacy, which helps patients navigate the complexities of the healthcare system as they battle life-threatening diseases. This all came about because of our former Congressman C.W. Bill Young to work on this critical legislation. Mr. Young met an 11-year-old girl named Brandy at a hospital in his district in Florida back in 1987. She was admitted to the hospital with a form of leukemia for which the only treatment was a bone marrow transplant. But there are no siblings, and thus no chance for finding a matched donor. That night, she died. Our former colleague Bill Young asked Brandy's doctors what could have been done. They said the answer would have been a transplant from an unrelated donor. The program we are working to reauthorize today could have made that possible. Finding a match is the key necessary to unlock the potential cure that bone marrow cord blood transplant offers. This legislation we move forward today will give patients and their families hope of access for a curative transplant. I hope we can move this legislation swiftly to passage before the program expires at the end of September. And I thank you all for your support, and I yield back.
Gentlelady's time has expired. Other members wishing to make a statement? Chair would recognize Gentlelady from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. I want to say just a little bit about the concrete checkoff bill, and I appreciate that we are moving that forward. In Tennessee, we have Middle Tennessee State University, which had one of the first concrete industry management programs and the first center of excellence for the concrete industry management. And they have done a fantastic job for this. They are excited that we are taking this action, that we are moving forward with a concrete checkoff. So I thank you for your leadership on that, and I look forward to having this on the floor so that we can help encourage more development in the concrete masonry industry and create jobs for those that are looking for these jobs in the building trades. I also want to express thanks for the public health bills that are before us today. We have heard on each of these bills from different members of the healthcare industry in our state, and we appreciate the leadership on those. And with that, I yield back.
Gentlelady yields back. Other members wish to make an opening statement? Seen none. Chair will call up H.R. 985 as favorably reported by the Subcommittee on Commerce, Manufacturing, and Trade on July 23rd and ask the clerk to report.
H.R. 985 to enable concrete masonry product manufacturers to establish, finance, and carry out a coordinated program of research, education, and promotion to improve, maintain, and develop markets for concrete masonry products.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any other amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 985 as amended to the House. All those in favor shall signify by saying aye. Aye. All those opposed say no. The ayes have it, and the bill is favorably reported. Chair now calls up H.R. 3154 and asks the clerk to report.
H.R. 3154 to allow manufacturers to meet warranty and labeling requirements for consumer products by displaying the terms of warranties on internet websites and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 3154 to the House. All those in favor will say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it. The bill is favorably reported. Chair now calls up 1344 as favorably reported by the Subcommittee on Health on July 23rd and asks the clerk to report.
H.R. 1344 to amend the Public Health Service Act to reauthorize a program for early detection, diagnosis, and treatment regarding deaf and hard of hearing newborns, infants, and young children.
And without objection, the first reading of the bill is dispensed with, and the bill again will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 1344 to the House. All those in favor shall signify by saying aye. Aye. All those opposed say no. In your chair, the ayes have it, and the bill is favorably reported. Chair now calls up H.R. 1462 and asks the clerk to report.
H.R. 1462 to combat the rise of prenatal opioid abuse and neonatal abstinence syndrome.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 1462 to the House. All those in favor will say aye. Aye. All those opposed say no. In your chair, the ayes have it. The bill is favorably reported. Chair now calls up H.R. 1725 and asks the clerk to report.
H.R. 1725, to amend and reauthorize the Controlled Substance Monitoring Program under Section 3990 of the Public Health Service Act and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 1725 to the House. All those in favor will say aye. Aye. Those opposed say no. In your chair, the ayes have it. The bill is favorably reported. Chair now calls up H.R. 2820 and asks the clerk to report.
H.R. 2820, to reauthorize the Stem Cell Therapeutic and Research Act of 2005 and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 2820 to the House. All those in favor will say aye. Aye. Those opposed say no. Being your chair, the ayes have it. The bill is favorably reported. Without objection, staff is authorized to make technical and conforming changes to the bills reported by the committee today. So ordered, and without objection, the committee stands adjourned.